Today we are going to talk about headaches. Headache is a pain or discomfort in the head or face area. There are two types of headaches, primary headaches and secondary headaches. In primary headaches, the headache is the illness itself. For example, migraine, tension type headaches, and cluster headache. In secondary headache, patient has an underlying illness which leads to the headache, such as meningitis and brain tumors. So let's go to our question for today. A 30-year-old male complains of unilateral headaches with rhinorrhea and tearing of the eye on the side of the headache. The episodes are precipitated by alcohol. Headaches may become problematic for weeks and months, after which a headache-free period occurs. Which of the following is the most likely diagnosis? Answer A, migraine. Answer B, cluster headache. Answer C, sinusitis. Answer D, tension headache. The answer is B, cluster headache. Cluster headaches occur in clusters. That means it would be present for a few months, same time every day, and then after some time the patient will have a headache-free period. This predominantly occurs in males more than females and commonly seen in the age of 20 to 30. The pain usually starts as a unilateral pain which begins around the eye, and it can become an excruciating pain within minutes. An episode can range from 30 minutes to 3 hours. They can develop lacrimation, redness in the ipsilateral side, and nasal congestion. They can even have Horner's syndrome. Management of cluster headache is divided into two pathways, that's abortive therapy and preventive therapy. 100% oxygen, sumatriptan, and a short course of steroids are used as abortive therapy, and to prevent we use verapamil, lithium, and anti-epileptic drugs like valproate and topiramate. Now let's go to our second question. A 42-year-old executive complains of a band-like tightness across the temples and neck, worse in the afternoon, usually relieved by paracetamol or acetaminophen. Neurological examination is normal. What is the diagnosis? Answer A, tension type headache. Answer B, cluster headache. Answer C, migraine. Answer D, temporal arteritis. The answer is A, tension type headache. This is the main cause of chronic daily headache. The patients usually complain of it being like a tight cap or band around their head. It's non-throbbing and occurs bilaterally. It's not aggravated by normal physical activities, and there is no associated nausea, vomiting, or photophobia. It can be present from 30 minutes to 7 days. In managing, tricyclic antidepressants like amitriptyline has a place, and stress management and regular aerobics exercises are helpful. Our third question is, a 13-year-old female presented with left-sided headache for 8 months duration associated with photophobia, phonophobia, and nausea. She also has bronchial asthma. What is the diagnosis? Answer A, giant cell arteritis. Answer B, cluster headache. Answer C, migraine. Answer D, brain tumor. The answer is C, migraine. Migraine commonly occurs in females than male, and it starts during early adult life. They generally have one episode which lasts for hours to 3 days and affects unilaterally in most of the time. The pain is typically in the frontotemporal region, which is moderate to severe in intensity, associated with pulsating and throbbing. It's associated with nausea, vomiting, photophobia, and even worsened with physical activity. These patients prefer to lie down in a quiet, dark room. There are two types of migraine, the migraine with aura and the migraine without aura. The commonest aura is a visual aura. When it comes to management, simple analgesia with antiemetics and triptans like sumatriptan are used. And as prophylaxis, they use beta blockers, tricyclic antidepressants, calcium channel blockers, 5-HT2 antagonists, anti-epileptic drugs, and angiotensin receptor blockers are used. So if you have any questions, you can drop them as comments below. I'd love to hear your suggestions on how I can improve my content. I'll see you guys all next week with another interesting video just like this. Until then, take care and goodbye.